President, you've done what generations of not just ordinary, but great men and women have attempted to do. Republicans as well as Democrats. They've tried before. Everybody knows the story, starting with Teddy Roosevelt. They've tried. They were real bold leaders. But, Mr. President, they fell short. You have turned, Mr. President, the right of every American to have access to decent health care into reality for the first time in American history.
Now, Vice President Biden is biased about the significance of the Affordable Care Act and about who he attributes it to, right? Most of us have made up our minds about it and probably have different opinions. But what he's saying about how long people have been working in Washington, D.C. to pass some kind of comprehensive national health care reform is generally held to be true. I'm Jimmy Parks, DRPH student at the College of Public Health. I'll be doing the lecture this week. The purpose of the class is to save you some web browsing and reading about the history of the healthcare reform by giving you a brief summary. I'm going to try to point out some examples of the policy types, instruments, and approaches that you've been talking about in this class so far. I'm also going to try to add some information about the state of your topic of interest as they emerge and changed over time. That is, the topics that you're going to do your policy analysis on. We'll see what those things we're doing through history. Now, there's not a lot of time to cover a lot of detail, so I'm going to put some links to references and other information up in the PowerPoint as we go along, and you'll find the references at the end once we get there. I'm going to try to talk a little slower. If it's too slow, use the play speed function on your media player. Most people are pretty easy to understand, even if you play them at double speed, and it obviously cuts your listening time in half. In one of the articles that you've been assigned, Burns suggests that we should take note of civil rights issues and their relationship to the course of healthcare reform history. Look also for what she says are, quote, campaigns that emphasize coalitions of professional advocacy groups as the centerpiece of their organizing strategy. I want to talk about the history of healthcare reform by breaking it up into periods. And before we discuss each period, I'll say a little bit of something about some of the tools and some of the topics that you're interested in that you might keep an eye out for coming up in that period. I'll try to point out some other things that overlap with the reading as well as we go along. But let's go ahead and start with the history. In the period coming up, very early on, you notice that health disparities were important and the impetus to a lot of this. Also, when we talk about poverty and illness and trying to get out of that, look at how they didn't think about prevention so much as they thought about treatment. That is, more health care could break this loop of poverty and illness. You'll also see sort of the beginnings of public health, and you'll see why Dr. Felix said that public health started to gain some authority and some power in the 30s. We'll start in the early 1900s.
Today, a hope of many years standing is in large part fulfilled. The civilization of the past 100 years, with its startling industrial changes, has tended more and more to make life insecure. Young people have come to wonder what would be their lot when they came to old age. The man with a job has wondered how long the job would last. This social security measure gives at least some protection to 30 millions of our citizens who will reap direct benefits through unemployment compensation, through old age pensions, and through increased services for the protection of children and the prevention of ill health. We can never insure 100% of the population against 100% of the hazards and vicissitudes of life, but we have tried to frame a law which will give some measure of protection to the average citizen and to his family against the loss of a job, and against poverty-stricken old age. It seems to me that if the Senate and the House of Representatives in this long and arduous session had done nothing more than pass this security bill, Social Security Act, the session would be regarded as historic for all time.
Also in this early period, you can hear from Roosevelt's speech that they're starting to talk about the long-term care of people after they retired, that sort of thing. It's not very strong language, but you can start to see that that's emerging. Now, during the Great Depression, which was from about 1929 to 1939, unemployment was high, medical care costs were rising, income disparities were growing, and a person's access to health care was dependent on how much money they made. Since sickness was a leading cause of poverty at the time, and poverty greatly restricted access to medical care, it seemed to a lot of people like an infinite loop. So citizen groups like workers, the unemployed, veterans, and the elderly were calling for help from the government to protect their health, but their main concern was the effects of unemployment. Not everybody was for it, though. The American Medical Association strongly opposed healthcare reform, since it threatened their control over the practice of medicine. That is, it threatened the autonomy of doctors. But other groups were opposed to reform as well, like business, labor groups, and the new private health insurance industry. President Roosevelt, at the time, had put a lot of research and effort into crafting legislation for healthcare reform, but he focused on the Social Security Act and felt like the national health insurance, some kind of universal coverage, would have killed the bill. He didn't feel like it was time for it. Now, there was a strong Democratic majority at the time, but Southern Democrats sided with Republicans to oppose government expansion in general, and partly to prevent segregation. That was a big issue at the time. So ultimately, the Social Security Act was passed, and it provided retirement benefits and unemployment insurance, but not national health insurance. Now, the states did get some funding for public health and maternal child health services, but the federal government basically put national health insurance on the shelf. The next phase is the 1940s and 50s. So in this next section, you might think about how some of these social determinants are playing into it. They've been there all along, but how social issues play out when the economy's doing really well.
I deem this reply a full acceptance of the Potsdam Declaration, which specifies the unconditional surrender of Japan.
We know that the greatest threat to us does not come from the communists in this country, where they are a noisy but a small and universally despised group. The greatest threat comes from communist imperialism abroad. Now I'm going to tell you how we're not going to fight communism. We're not going to transform our fine FBI into a Gestapo secret police. That's what some people would like to do. We're not going to try to control what our people read and say and think. We're not going to turn the United States into a right-wing totalitarian country in order to deal with a left-wing totalitarian threat.
If the congressional elements that made the Taft-Hartley law are allowed to remain in power, and if these elements are further encouraged by the election of a Republican president, you men of labor can expect to be hit by a steady barrage of body blows. And if you stay at home, as you did in 1946, and keep these reactionaries in power, you'll deserve every blow you get.
During and after World War II, the capitalist U.S. economy expanded a lot. U.S. businesses did very well. They were growing, particularly large corporations did well, and they needed a lot of workers. They needed workers so bad that they offered group health insurance plans, and were even negotiate generously with unions for more employee benefits, some of which included health insurance. So President Truman picked up on some of the shelved ideas of Roosevelt to form what he called a fair deal, a single national health insurance system to cover all Americans and that would be part of the Social Security system. He also proposed support for the construction and expansion of hospitals. You may have heard of the Hill-Burton Act. Again, concerns that federal control of health care might lead to action against segregated hospitals split the Democratic Party, and it kind of watered down support for health reform. The unions were split too. Since companies were negotiating pretty well with them, they've been getting a pretty good deal from industry, so help from the government didn't seem so urgent or necessary. The American Medical Association again opposed the plan, as did the American Hospital Association, the American Bar Association, Chamber of Commerce, and other national organizations. In the media, opponents characterized the fair deal as socialized medicine, which, with the popularity of anti-communism at the time, was a pretty effective strategy. Since employer-based health insurance was growing, reformists kind of simmered down and national health care reforms sort of stalled again. Now, the Hill-Burton Act did pass. That gave money and resources, encouraged the building of and expansion of hospitals. And this did influence the course of healthcare reform in some interesting ways. We'll see as we go along. Might also look at the Starr book. I also want to say that the Byrne article goes on to provide some good specific examples of some of the social context of the history of healthcare reform that I only touch on here. For example, she has an interesting story about the involvement of the Socialist Party in the early days of healthcare reform. Might give you a little better understanding about how the fair deal was framed as socialized medicine and why that was effective. So let's move on to the 1960s. In the 1960s, they're going to start talking about care for the poor and elderly. So long-term care becomes an issue. With Medicare and Medicaid, health information portability starts to become important, right? Confidentiality and patient information starts to become important.
All Americans must have the privileges of citizenship, regardless of race. And they are going to have those privileges of citizenship, regardless of race. Of course, people cannot contribute to the nation if they are never taught to read or write. If their bodies are stunted from hunger, if their sickness goes untended, if their life is spent in hopeless poverty, just drawing a welfare check. So we want to open the gates to opportunity. But we're also going to give all our people, black and white, the help that they need to walk through those gates. My first job after college was as a teacher in Cotulla, Texas, in a small Mexican-American school. Few of them could speak English, and I couldn't speak much Spanish. My students were poor, and they often came to class without breakfast, hungry. And they knew, even in their youth, the pain of prejudice. They never seemed to know why people disliked them. But they knew it was so, because I saw it in their eyes. I often walked home late in the afternoon after the classes were finished, wishing there was more that I could do. And somehow you never forget what poverty and hatred can do when you see its scars on the hopeful face of a young child. I never thought then, in 1928, that I would be standing here in 1965. It never even occurred to me in my fondest dreams that I might have the chance to help the sons and daughters of those students and to help people like them all over this country. But now I do have that chance. And I'll let you in on a secret. I mean to use it. While we have accomplished much, much remains for us to meet, and much remains for us to master. In some areas, the jobless rate is still 3 or 4 times the national average. Violence has shown its face in some of our cities. Crime increases on our streets. Income for farm workers remains far behind that for urban workers. And parity for our farmers who produce our food is still just a hope and not an achievement. New housing construction is far less than we need to assure decent shelter for every family. Hospital and medical costs are high and they're rising. Many rivers and the air in many cities remain badly polluted, and our citizens suffer from breathing that air. We lived with conditions like these for many, many years, but much that we once accepted as inevitable, we now find absolutely intolerable. So this, my friends, is the state of our union. Seeking, building, tested many times this past year, and always equal to the test.
Though the economy continued to grow, problems with the employer-based insurance began to emerge, especially its lack of coverage for the poor, the disabled, and elderly. Labor unions were starting to realize it was pretty costly for employers to insure retirees, and hospital and health insurance industries were also realizing that it was unprofitable to care for the elderly. So Medicaid was proposed to help pay for long-term care of the poor and health insurance for some of the poor and disabled. It wasn't very popular, and cost control was delegated to the health insurance industry. That is, the government chose not to do much regulation of cost and charges. Now, Medicare was proposed to provide hospital coverage to seniors. The AMA continued to oppose Medicare as socialized medicine. The growing civil rights awareness of the time, along with support from the Hospital Association, the health insurance industry, and the public, provided a window of opportunity for the policy. Finally, when President Johnson won a landslide election, he made healthcare reform his highest legislative priority. He gained support from key Southern Democrats, including Wilbur Mills, to unify the party around it, and they passed Medicare and Medicaid, probably the most significant healthcare reform in the 20th century.
The final Medicare and Medicaid bill passed both houses of Congress by an overwhelming vote. President Johnson signed the bill, making it the law of the land, July 30th, 1965, in Independence, Missouri, in the presence of former President Truman. Later, President Johnson helped President Truman sign up for the voluntary part of Medicare.
They told me, President Truman, that if you wish to get the voluntary medical insurance, that you'll have to sign this application form. And they asked me to sign as your witness. So you're getting special treatment since cards won't go out to the other folks until the end of this month. But we wanted you to know, and we wanted the entire world to know, that we haven't forgotten who is the real daddy of Medicare.
Importantly, healthcare cost containment, including the economic cost of these programs, were not a focus of the political debate at the time. So as we start to go through the 70s, keep an eye out for how these health cares are becoming more complex. And I think this is important when we talk about health literacy, because they're related in that health systems become bigger and more complex, and they can get to the point where people don't understand them and they're just not helpful to people. Don't forget to look for in some of these plans, are they using taxes, are they using coercion, are they using regulation as tools? And I think you'll see as they become more complex, they're using all of these more and more.
In terms of a president for the first time addressing this organization, and because this is a significant year in terms of what may happen with regard to health care as far as your national government is concerned, I thought, Mr. Kaufman, it would be appropriate for me to read a statement, a presidential statement that I prepared, in which I will be talking to you, but also will be talking to the nation about the health care proposals that the Congress will be considering during the course of this year. I think the time has come to make it possible for every American to have access financially to the best health care this nation is capable of providing. Those who can afford it should pay for it, but those who cannot afford it must not have it denied on that account. We don't want a generation of Americans on the 200th anniversary of this country, that's just 3 years away, to look back and wonder why, in the richest country in the world, some were denied the right to live because, in the starkest sense, they just couldn't afford it. There are those who say that health services in America can only be improved and extended by the federal government. And with that, I totally disagree. I believe we should build on the great strengths of the health care system in this country that we already have and not destroy them. For 5 years, we've been building on the strengths of that system, and for 5 years we've made solid progress. I could go over the litany of what we have done. We've increased the budget. We just put out the budget yesterday, and comparing with what it was in the year 1969, 5 years ago, it's gone from $17 billion to over $35 billion for health care, including new initiatives in the field of cancer and heart disease and sickle cell anemia and drug abuse and many other areas with which all of you are familiar. And I repeat that while we do have the finest health care anywhere in the world, there are still too many Americans who lack health insurance protection. It might not be necessary. Less than half of the present programs have major medical coverage that pays for long, expensive, what we call catastrophic illnesses. And very few over 65 have this protection at an age it is often most needed. What this all means is that a very substantial number of our people simply cannot afford the high-quality medical care that is now available in America. I'm going to send a new proposal to the Congress to get this job done, and I'm going to urge enactment at the earliest date. The name of the program, the Comprehensive Health Insurance Plan. It has 7 main principles. Listen to them carefully. What they do say and what they do not say. What they do not say insofar as federal involvement is concerned. First, it will offer every American financial access to balanced, comprehensive health care protection. Second, its cost will be based on each person's ability to pay. It will build on our existing public and private health financing systems and not destroy them. It will use public funds only when needed. It will maintain the freedom of both the patients and the doctors to choose. It will encourage the most effective use of our health care resources. And finally, it will give every American a direct stake in making the system work. Now, building on these principles, the same balanced, dignified health care protection would be offered to every American under one of 3 plans. There would be a special employment plan, which would be offered where people do work and can contribute to the plan. There would be a government assistance plan which would cover people with low incomes and those who can't purchase health insurance at a reasonable cost, such as those already in poor health or those whose work entails risks. And finally, the existing Medicare program would continue to serve those over 65, but it would offer improved benefits matching those in the other plans that we are recommending. These plans would largely operate through the existing private insurance carriers. Medicare would continue to be administered as it is now. Coverage under all these plans would be identical. It would finance virtually all of the health protection people need: hospital and physicians' care in and out of the hospital, drugs, laboratory tests, x-rays, medical devices, ambulance service, and so forth. One of the most critical features of this comprehensive plan is the way it would be financed. For those who are working and who are under the employment plan, the employer would pay the bulk of the cost of the premiums while the employee would pay the rest. But note, the employee as well as the employer pays. For those who come under the government assistance plan, there would be a sharing of costs with the government based upon the individual ability to pay for premium. Again, if the individual is able to pay even a small part, he does pay. No premiums would be charged, only for those who have very low incomes, who cannot afford to pay premiums. The insurance itself would be channeled, again, through private insurance companies. The overall result is, under this plan, that we would not have to have any new federal taxes. The additional costs could be paid for out of revenue that would be already available.
In the early 1970s, the economy kept growing, but inflation was a problem. And more specifically, healthcare costs almost tripled in the 5 years since Medicare and Medicaid had passed. Senator Ted Kennedy, author of The Healthcare Crisis in America, wanted a national, universal, single-payer plan with no consumer cost sharing that would be funded by payroll taxes. President Nixon wanted universal coverage, voluntary employer participation, and a separate program for the working poor and the unemployed that would replace Medicaid. Now, there were many other versions of healthcare reform competing for support at the time, and many of the interest groups who had taken clear sides on the issue before were not as successful at deciding exactly which proposals were best for them. For example, business and industry generally supported Nixon's plan, but there were other plans that were more favorable for industry. The AMA, the American Medical Association, couldn't fight Nixon's plan as a socialist plan since he had built some credibility as an anti-communist president. Now, the unions supported reform, but felt time was on their side and that a better deal for workers might come if they were patient and waited for a new administration or a more favorable Congress. So, lack of consensus and plus the distractions of the scandal and war kept healthcare reform from passing in the early 70s. Meanwhile, the economy stagnated and inflation continued. You also look for in this section how government starts to move away from persuasion and taxing and spending to control some of these health issues and start moving towards regulation. That's way oversimplified, but just pay attention to those kind of ideas and make up your own mind about them.
The government has been spending too great a portion of what our nation produces. During my campaign, I promised to cut the government share of our total national spending from 23%, which it was then, to 21% in fiscal year 1981. We now plan to meet that goal 1 year earlier. Reducing the deficit will require difficult and unpleasant decisions. We must face a time of national austerity. Hard choices are necessary if we want to avoid consequences that are even worse. I intend to make those hard choices. I have already vetoed bills that would undermine our fight against inflation, and the Congress has sustained those vetoes. I know that the Congress will continue to cooperate in the effort to meet our needs in responsible, non-inflationary ways. I will use the administrative and the budgetary powers of my office, including the veto if necessary, to keep our nation firmly on the path of fiscal restraint. Restraint involves tax policy as well as spending decisions. Tax reduction has never been more politically popular than it is today. But if future tax cuts are made rashly, with no eye on the budget deficits, they will hurt us all by causing more inflation. There are tax cuts which could directly lower costs and prices and help in the fight against inflation. I may consider ways to reduce those particular taxes while still cutting the budget deficit. But until we have a convincing prospect of controlling inflation, I will oppose any further reductions in federal income taxes. To keep the government to a manageable size, I'm ordering tonight a cut in federal hiring. This order will mean a reduction of more than 20,000 in the number of permanent federal employees already budgeted for this fiscal year, and will cut the total size of the federal workforce. I've already placed a 5.5% cap on the pay increase for federal employees, and federal executive officers are receiving no pay increases at all. It's not enough just to control government deficits, spending, and hiring. We must also control the costs of government regulations. In recent years, Congress has passed a number of landmark statutes to improve social and environmental conditions. We must and we will continue progress toward protecting the health and safety of the American people. But we must also realize that everything has a price and that consumers eventually pick up the tab. Where regulations are essential, they must be efficient. Where they fight inflation, they should be encouraged. Where they are unnecessary, they should be removed.
President Carter ran for office promising to support national health care reform, but once in office, he focused more on trying to contain health care costs. He said that health care reform should wait until after the economy was stronger. Now, Carter and Kennedy both proposed plans that had complex payment systems. There were price-setting formulas and incentives that were complex for employers, insurers, and providers. So the troubled economy and the scandals of the early 70s also led to a rise in conservatism and some procedural changes in the legislative system that were meant to reduce the power of the federal government and made it harder to get bills through committee. So it made it harder for the federal government to be decisive. So national health care reform had trouble moving along in the late 70s and early 80s as well. Now, one result of the focus on cost containment, though, was the Medicare prospective payment system enacted in 1983. Now, this was a system where government began to pay providers a predetermined set rate based on the patient's diagnosis, instead of, as they previously done, paid based on what the providers decided to charge. In the 1980s, taxes were cut, defense spending grew, and domestic programs shrunk. In this next phase, look at how long-term care concerns come to the forefront as we have more people who are moving towards a time in life where they might need long-term care.
The end of the Cold War, the information age, the global economy have brought us both opportunity and hope, and strife and uncertainty. Our purpose in this dynamic age must be to make change our friend and not our enemy. To achieve that goal, we must face all our challenges with confidence, with faith, and with discipline. Whether we're reducing the deficit, creating tomorrow's jobs and training our people to fill them, converting from a high-tech defense to a high-tech domestic economy, expanding trade, reinventing government, making our streets safer, or rewarding work over idleness. All these challenges require us to change. If Americans are to have the courage to change in a difficult time, we must first be secure in our most basic needs. Tonight I want to talk to you about the most critical thing we can do to build that security. This health care system of ours is badly broken, and it is time to fix it. Despite the dedication of literally millions of talented healthcare professionals, our healthcare is too uncertain and too expensive, too bureaucratic and too wasteful. It has too much fraud and too much greed. At long last, after decades of false starts, we must make this our most urgent priority. Giving every American health security, health care that can never be taken away, health care that is always there. That is what we must do tonight. On this journey, as on all others of true consequence, there will be rough spots in the road and honest disagreements about how we should proceed. After all, this is a complicated issue. But every successful journey is guided by fixed stars. And if we can agree on some basic values and principles, we will reach this destination, and we will reach it together. So tonight I want to talk to you about the principles that I believe must embody our efforts to reform America's healthcare system. Security, simplicity, savings, choice, quality, and responsibility.
Through the 80s and 90s, the economy had serious episodes of recession, and political and popular attention was again focused on the economy. This caused people, baby boomers, to worry about their ability to continue to pay high healthcare costs as they grew older. Many big and diverse plans were advocated in Washington at this time. Some were market-oriented reforms that would expand the private healthcare system, private insurance system. There were public single-payer plans. There were employer-mandated plans, healthcare tax credit, and other purchasing tools that would supposedly give money to people to make their own decisions. President Clinton adopted a managed competition approach, and he called it the Health Security Act. It included universal coverage, employer and individual mandates for participation, competition between insurers, and government regulation to keep costs down. If you'll recall, this is something that government resisted doing since the 1920s, all the way along. Clinton planned to pass health care reform in the first 100 days of his presidency. But the complexity of his proposal and the wide diversity of competing plans served to split interest groups still. Interest groups might have conditional support for several programs, but few gave full support to any single program. Small businesses felt like employer mandates hurt them. Small businesses would have to participate in the system even if they didn't feel like they could afford it. They thought some small businesses might go out of business. The health insurance industry resisted as well, and their strong opposition to the Clinton plan and their powerful media campaign, along with the split interest of other groups, made it impossible for a divided Democratic Congress to pass the health care reform. In 1997, though, a Republican Congress with bipartisan support passed the Children's Health Insurance Program, a program that provided health coverage to more low-income children. This leads us to the 21st century, where, despite the controversy that still swirls around it, a form of universal coverage was passed as the Affordable Care Act. Since the Oberlander article is required reading for the course, I won't go into much detail about the specific content and context of the Obama administration's efforts to pass the health care reform. I just want to say that President Obama had many of the same challenges that all of these other presidents had, like the partisan and special interest group pressures, the economic troubles, and the distrust of government. He also had some of the same advantages, right? A strong commitment a Democratic Congress, if only slightly, and public demand for a change. So now it's time for a discussion question. Think about what's different about this administration's approach, their instrument selection, or their healthcare reform plan as compared to other previous administrations. Also think about what's different about the social, political, and economic context now than in the past. The question is, briefly describe 2 of those factors that you think are most influential to the passage of national healthcare reform this time around. I'm not as interested in a right answer as I am in an answer that you find most compelling and perhaps most relevant to the policy topic you'll be using for your policy analysis project at the end of this course.